Hi everyone. I was going to wait a few minutes, but everyone went quiet, so I thought I'd start anyway. As the name suggests, my name is Dr Lauren Sherar. I'll just start off a little bit about who I am. I'm a university lecturer, so I'm a senior lecturer. I teach undergraduate students, and I also do research in the area of children's physical activity, health and promotion. I did my academic training in my first academic position in Canada, so I was in Canada for about 10 years, and I worked a lot in schools there. And then I've been in Loughborough University for about 6 years. So I'm not a teacher, and I've actually never had teacher training. So really my position here comes from my perspective of working with schools around trying to encourage physical activity, and a little bit of my observations of looking at the recent progressions that have happened in terms of schools' responsibility in increasing the agenda of physical activity and also weight management. So I think all researchers' interests and the research that they do is tainted by their lived experiences. So my research in particular is tainted by the fact that I'm a mother of 3, who are down here, and also a proud auntie of 2. And I think I really am motivated to increase the health of the current generation, but also future generations, that I'm sure you are too. So that's really kind of where my motive comes from today. So a few disclaimers to start off with. So the title was quite emotive in what I stated. I'm not going to be spending a whole lot of time talking about educational policies, which maybe Professor Lorraine Kale could probably answer more about. Also, anything to do with government spending, partly because I probably couldn't do that in 45 minutes to an hour, but I'm also probably not the best person to do that. I'm also not going to be talking particularly about preschool populations or higher education or further education, just again because I haven't got enough time to do that. There are lots of really great topics, such as whether we should be doing fitness testing in schools, which would be a great debate. And something we should probably talk about at some point, but I won't have enough time to do that today. And although I talked about health of children, that does include a lot of health behaviours, such as nutrition and smoking. Today I'm going to be concentrating mainly on the topic of physical activity and decreasing sedentary behaviour. So this is what I'm not going to be covering, and this is now what I am going to be covering. So the first thing, and I imagine that I'm really speaking to the converted. So I think you all probably know the benefits of physical activity, but I'm still going to talk about them now. So movement really is the best medicine. There isn't another medicine out there which is so good at preventing ill health, about enhancing rehabilitation, and about improving side effects if someone does get sick. But it also is like a vitamin. That's why it's so good for children. So physical activity can actually prevent diseases from occurring and can also enhance the health-related quality of life of our children. So what we have up here is a bar chart, and we have all of the risk factors at the world level that are attributed to death, to mortality. And we have them in rank order here, from the least important up here to the more important, and we have it by high income, middle income and low income countries. So this is worldwide, and as you can see, some like water sanitation is a bigger issue in terms of mortality or predicting mortality in low and middle income countries. Now there are 6 risk factors that are up there that I've covered up. Can anyone think what those 6 risk factors could be? I've given you a real hint what one of them probably is.
Physical inactivity.
Physical inactivity, perfect. Any other ones? Smoking, that's right, that's 2.
Type 2 diabetes.
Yeah, glucose control.
Obesity.
Obesity. Diet could be on there. So the cholesterol, the high cholesterol, overweight and obesity, we've got high blood glucose, so we've got blood pressure on there. As you can see, now physical inactivity is the 4th leading risk factor for mortality worldwide. We would actually say it's the biggest priority though. Because it's the 4th leading one, that's important. But actually, increasing physical activity actually improves all of the top 6 risk factors for mortality. So if we can actually get the population worldwide to be more active, we will prevent mortality by even more than just that risk factor. Now, we have known about the benefits of exercise for a long time, so if you are my age or older, you will know or recognise some of these TV icons from the 80s and 90s. The exercise programmes that were in the breakfast TV, which were quite commonplace, are really a reflection of the recognition, even in the 80s and 90s, of the importance of structured physical activity. And this was actually the moderate to vigorous range. So we've known for a very long time that structured moderate to vigorous physical activity, at least in adults, is really important for our health. But now we have a recognition that actually physical activity in all shapes and sizes is important for our health. So this could include walking to and from school. It could include recreational activity of a fairly low intensity with the family, or actually free play. So physical activity is that umbrella term which includes structured exercise, but also includes any activity which is even at a low intensity from rest. But we also have a recognition that sedentary behaviour is actually different from inactivity. So someone can be meeting physical activity guidelines, so they can be active, but they can also be very sedentary, so they can be sitting for a large period of the day. So for example, if I run 3 times per week, I'm being active, but I could be sitting for 8 hours of the day, which means that I'm sedentary too. And we see that same profile with children. So we now have a recognition that physical activity comes in all shapes and sizes and is important from our health. Anything from quite low intensity all the way through to moderate to vigorous. But also we need to decrease sedentary behaviour. And another word for sedentary behaviour is sitting behaviour. So there are multitude benefits of physical activity, anything from cardiometabolic benefits in children, health and well-being, psychological benefits, social benefits, and even something that's emerged in the more recent years, about the last 5 to 10 years, is a potential association with academic achievement or cognition. So it really is the wonder drug. If we were going to be prescribing our children any type of drug, physical activity would be it, because it really is helpful for the whole holistic perspective of a child. Now, I think the mental health, I was talking earlier about this, I think mental health is really important, and this was actually raised only recently in the media with a study that showed that 1 in 4 teenage girls are depressed by their own accounts, so self-reported. So physical activity really can be used to maybe curb this problem also. So in addition to the current health of children and the important benefits that increasing physical activity or reducing sedentary behaviour, it is also believed that healthy, active children will become healthy, active adults. So the behaviours that are installed during childhood track into the adult years. Now, I should say at this point, it doesn't mean that every active child is going to become an active adult, but we do know that inactive children have got much less chance of being an active adult. So an active child that can track these behaviours through will have even more health benefits as they get into adulthood. So back in 2012, the chief medical officers of the home countries in the UK got together and they came up with some physical activity guidelines for different age groups of the population. And for the first time, the UK guidelines actually matched other guidelines across the world, which was great. And the guidelines I'm just going to highlight today, because we're talking about children, are the ones from 5 to 18 years of age. So as you're probably all well aware, the recommendation is that all children should be participating at a minimum of at least 60 minutes of moderate to vigorous physical activity per day. There was also a recommendation to reduce sedentary behaviour and also to include 3 times per week muscle and bone strengthening exercises. So hopefully, even if you didn't know before, I've convinced you that physical activity is really important for children. But now we're going to talk about whether it is a weighty problem. So This is data from the Health Survey from England from 2012. And so this is self-reported data, which shows that only 2 in 10 of English children, about 20% of English children, meet the physical activity recommendations previously stated. And we have to remember when we're looking at this, that this is the minimum. Okay, so these aren't necessarily very active children. These are just children that are meeting the minimum recommendations set out by the CMOs. Something to always think about, especially in the UK, because we don't have a national surveillance that uses objective measurements of physical activity, is that we've got to be a little bit careful when we're using questionnaires to measure physical activity, especially in children but also in adults. So this is an example of a study in 6 to 7-year-olds which looked at the minutes of moderate to vigorous physical activity when they asked the children. And it came out on average at just over 140 minutes of moderate to vigorous physical activity per day. So pretty good. In the same sample, that were asked to wear an accelerometer. So the activity they actually did over the 7 days that they reported on were actually objectively measured. So this is what they actually did. And as you can see, when we objectively measured, those same children actually only accrued just over 20 minutes of moderate to vigorous physical activity per day. So this has really important ramifications, because if we're just going to be using questionnaires and asking children or parents how active their children are, because of self-report biases, social recall issues, it's really hard to know what the actual activity levels are. So this is some data which gives you a little bit of a global perspective, and this is from the International Children's Accelerometry Database, which I'm involved in. So for the first time, the ICAD has accumulated lots of objectively measured physical activity from accelerometers on children from across the world. And this is the best data that we have that's objectively measured. And as you can see, here is the here is the proportion of children meeting physical activity guidelines from England in comparison to the other countries. So we're really not doing that well. Something else to note is that one of the most pervasive findings in public health is that there's an age-related decline in physical activity. So here is the minutes of physical activity on the y-axis, and this is age. And it doesn't matter which paper you look at, you will always see an age-related decline in activity. And part of it is probably to be expected, because even in animals we see a decline in activity over their adolescent period. Okay, but this decline is getting steeper. The other pervasive finding that we see is always that girls are less active than boys at every single age. However, one thing to remember that any of you that are parents or work with children will know is that girls mature on average, only on average, biologically 2 years before boys. Okay, so if this association, if biological maturity is related to this activity level, and that's why during the teenage period the activity levels are declining, then if we align activity, this time not by chronological age, but this time by their years from peak height velocity, which is basically just making sure that here we're comparing boys and girls of the same biological age, we see that the gender difference disappears. So that's quite a lot to get your head around, but basically implies that perhaps the reason that girls are less active than boys at every single age or every single grade in school is actually because they're maturing earlier. So this suggests that there's something around the maturity, around entering puberty in adolescence, that is probably related to a disengagement from physical activity. So the reason that I highlight this here is that a lot of attention has gone on girls, okay, trying to get girls more active, and that's really important. But we mustn't forget about boys. It's likely that they are disengaging from physical activity. It's just occurring a little bit later. So this is self-reported data, but this data is quite nice in that it's more local. So this is some very recent data, self-report data from Leicester City. And so the prevalence is quite similar, and unfortunately the story isn't that great even at a local level. So only 1 in 5 children who were in a self-report survey participated in physical activity on all 7 days of the week. And probably even maybe more shocking to me is that 30% of 14 to 15-year-olds had looked at screens for 5 hours or more the day before the survey. So if we're thinking that most of the time the children are on screens, they're not being active, this is an awful lot of sedentary time taken up by consuming screens. So just wanted to highlight this because it's a little bit more of local data. So just to quickly answer my first question, physical inactivity is a significant problem, however you slice the data, whether you look at self-report or objectively measured physical activity. But something that's quite worth looking at is whether physical activity is associated with obesity. And the main reason why I'm concentrating on obesity, and we'll go into this more later on, is that childhood obesity has been flagged as a major issue in the UK more recently with the Childhood Obesity Strategy, which was released by Public Health England and the Department of Health. So what is the prevalence of obesity in the UK? So this is data from the National Child Measurement Programme. They collect data at 2 time points, at reception age and at year 6. And what they've shown is that in reception age, about 9.3% of the children measured were obese, and about nearly 20% of the year 6s were obese. So quite high prevalence. When you add that to the overweight statistics, it's a large portion of our children are classified as overweight or obese. A little bit of a promising story in that the reception age prevalence of obesity seems between 2006 and 2016, so over a 10-year period, does seem to be plateauing. Okay, but in the older age group, it's still going up. Now, you can ignore a little bit of this and just focus in on these 2 graphs here. Probably the most worrying statistics that come out of the National Weight Measurement Programme is actually when you look at the data by deprivation. So it does seem that obesity is largely linked to deprivation, in that the children that are most deprived are more likely to be more overweight or obese. And probably even a bigger issue is that this gap between the least deprived and most deprived is increasing over the years. So whatever we're doing to try and combat childhood obesity is not reaching children of low deprivation, which is quite alarming from a public health perspective. So there are a large number of consequences, ill health as associated with obesity, from physical, social and psychological. So it's worth considering whether there is an association between physical activity and adiposity. It seems natural that there would be. If you're thinking about the energy balance equation, more energy in and more energy out. So if nutrition is staying the same, which we're not going to talk about that today, but if nutrition is staying the same in our young people and they're being less active, the assumption is that they will gain weight. And there's been quite a number of systematic reviews of the literature, and most of them show that there's a fairly good association between physical activity and obesity. So the more active children are, the less obese they are. However, it is worth noting, before I progress on, that body mass index, which is weight divided by height squared, is not a great indicator of body composition at the individual level, but it's particularly not very good in children. So this is a child from a longitudinal study from Canada that I was involved in. This is the same child, once at age 11 and another at age 14. At age 11, this child was classified as obese by body mass index, and by age 14, he was classified as normal weight. We had information about his diet and physical activity, and that hadn't changed between these 2 time points. So what happened to this child to have such a drastic impact on his body composition? Does anyone know? Not physical activity, because we didn't have a great measure of it, but that hadn't changed across this time. Perfect. So this child went through his adolescent growth spurt in height. That was all that we could tell that had changed. So it's just worth noting that if we are trying to judge physical activity interventions in schools, for example, on a change in body mass index, the impact of growth and development is going to far outweigh, whether it's positive or negative, any impact that we're going to have, that we're going to be able to measure from physical activity. It doesn't mean that physical activity is not having a good impact on body composition and health of the child, but it's really hard to measure through body mass index. And I think that's always really important to note. So just to summarise on that, BMI is really good to survey on a population level to see if over time we're actually having an effect on childhood obesity. But we have to remember that it's not good at an individual level. So if we are, as we do currently, give information back to parents about body mass index of their child, I think we need to be more cautious about how we do deliver that. Physical activity is so important for a child's health, irrespective of body maintenance or weight loss, and we do have to remember that. And we also need to focus, make sure we're not forgetting the normal weight inactive child. Remember all of that host of benefits, physical, psychological, social benefits that a child will get from physical activity. If they are normal weight and inactive, they're not getting any of those other health benefits. So, in terms of combating physical activity, I would suggest that there's no silver bullet. So, this is just an example of, this is one way of me trying to show that physical activity has been engineered out of our lives over a period of time. So this is quite a nice case study that was published in the Daily Mail. And what it shows is the roaming distance of 4 generations of people from the same family. So when I say roaming, this is the distance that they were allowed to independently travel as a child. So if we look at the great-grandfather, whose name was George, at age 8 in 1990, he was allowed to walk 6 miles to go fishing. And if you look here, this big circle, that's George's roaming distance. So he was accumulating independently lots of physical activity by just his roaming distance. His child, Jack, at age 8 in 1950, was able to walk about 1 mile on his own, and that's his roaming distance. If we look at his daughter here, Vicky, at the same age, she was able to walk to the swimming pool, which was about half a mile. So that's her roaming distance. And then Ed, who could be considered a child in our current generation, he was allowed to walk to the end of the road and back. Okay. So over 4 generations, we've seen this massive difference in the distance that children are allowed to roam. And we could say this is because we're bubble wrapping our kids these days, that we're too worried about the perceived risks and safety concerns that are out there. But it's worth noting that if Ed was to roam the same distance that George did, he would have to cross the M5. Okay, so whether they're perceived, there are actual barriers that are stopping our children from being as active as they were 4 generations prior. So again, no silver bullet. This is something that has been happening for a long while. And I was trying to think for today's lecture of some analogy around this kind of engineering activity out of our children's life. And I've thought about a bucket full of water. So the bucket is trying to imply that we only have a certain amount of hours in a day where we can encourage children to be more active. The water in the bucket is the physical activity levels. So if we think now how activity has been engineered out of our children's lives, our children today are much likely to take passive forms of commuting, so in a car. There are lots of tiny little nudges, things that we used to do manually that are now done automatically for us. Tiny little increments of activity that have been removed from our lives now. I don't think my children know that you have to actually get up and switch on a TV. Screens, the huge invasion of screens that we have in our children's lives, these are going to have an impact on the activity that they have. The phenomenon of children going and knocking on kids' doors to go out and play. I'm not sure where you all live, but where I live, that doesn't happen that often. It might be organised play dates, but children aren't going around and accumulating friends to go play. There is definitely a phenomenon about safety concerns, about bubble wrapping our kids that's happened now. We see issues where playgrounds aren't used as much. and active play is becoming more extinct. Probably, if I could challenge you tomorrow, you could probably, if you were looking out for it, see in an environment close to where you work or where you live, some restriction, something that's telling you not to be active. So not to climb a tree, not to play ball games. We have a few of them on campus here where we're telling the students not to be active.
But those signs there have been around for ages. It's not, those signs aren't anything new.
Were they around?
I certainly remember when I was
Oh, can you? Oh, yes, I wasn't around then, so I'm not sure. But I think there probably is more of them, and we've definitely got more cases of issues with children not being allowed to. For example, there was a family who had a rental agreement, and they were told that their rental agreement would be stopped because their children were playing outside and annoying the neighbours. So I think there has seemed to have been a bit of a steady increase in them. But like all of these, they're mainly anecdotal because we don't have the data to survey them over the years. So this was really just to iterate that all of these little cases are causing lots of holes in this bucket, which is causing the physical activity to come out. And if we're wanting to try and solve this, we're going to need good band-aids or plasters or some ways of plugging up these holes, and they need to be probably different to what they have before. So getting to really the main kind of topic of this presentation is this physical inactivity crisis, maybe even the obesity epidemic, a school's responsibility? And I'm going to answer the question straight away. I think, yes, it is the school's responsibility in part, but I think by saying it's the school's responsibility, we have to make sure that we're not attributing blame. In fact, they're probably not the reason why there's inactivity now or the obesity epidemic. So, for example, if we look back to, say, the 1920s or the 1930s, where obesity was non-existent in children and activity was probably fairly high, schools weren't encouraging as much physical activity as they do today, likely. And if you think back to the bucket that I showed you in the last slide, nearly all of those situations, nearly all of those causes are actually not to do with schools. They're to do with things that are outside of the school day. However, we do see in the media quite a lot of pressure from the media about schools taking on the physical activity agenda, preventing sedentary behaviour. So this is something that's definitely topical. And I would say that we don't see that same pressure for parents to increase physical activity. And it might be because parents are buying newspapers and schools are not, I'm not sure. But there definitely is a lot of pressure. So something else that has really placed physical inactivity as part of the school's agenda was a recent release, a plan from action, released by the Department of Health and Public Health England around childhood obesity, where they have not mandated, but they've pleaded with schools or asked schools to provide at least 30 minutes of moderate to vigorous physical activity per day. So this is half of the recommended physical activity that a child should be doing. Our government has asked schools to provide at least half of that within the school day. So whether we like it, whether we think it's a good thing or we think a bad thing, it is part of the school's agenda now. So it's quite easy to see why schools are attractive as a setting for promoting physical activity. You do have a captive audience. You can, through schools, you can actually target at-risk children or children that are often overlooked in other public health realms. It's very suitable for multi-component interventions, so if you're wanting to couple, for example, nutrition and physical activity. Schools obviously have a continuous and an intensive exposure and contact with children. Okay, so it's something that can last all the way through from when they're very young all the way through till they reach adulthood. And unlike in families, there's actually opportunities for mandated physical activity. We obviously can't mandate families or communities to do physical activity, but we could have that opportunity to do it for schools. But one thing that's probably a little bit more positive than all the other ones is that physical activity can actually enhance teaching, cognition, academic learning. Okay, so actually by having a more physically active school, perhaps we can actually have a more happier, healthier, and children that are actually learning better. So this figure just really highlights the quite complex associations between cognitive functioning and behaviour. And I would be amiss to say that we don't have an abundance of data to suggest that if we have active children, they're suddenly going to increase their GCSE scores or grades. But there is quite a lot of promising information to suggest through multiple avenues that children who are more active will learn better. And this could be due to physiological adaptations, such as increased blood flow to the brain, but also social and learning behaviours that can be learned through being physically active. We always have to recognise there are lots of others, such as genetics, IQ, homework, socioeconomic status, that impact academic achievement. But physical activity could have a really important part and a really promising part in enhancing physical activity, academic achievement. So it's quite useful to have a look and see if we are making physical activity a responsibility of the schools, what are some of the shared benefits that can happen? So physical activity can be used to improve academic achievement, as I previously mentioned. It might be able to improve attendance, reductions in disruptive classroom behaviour, particularly in certain pupils. It may enhance employability skills, pro-social behaviour, opportunities to be challenged. So there are a lot of skills that schools genuinely want to foster in their children that can actually be enhanced through physical activity. Now, we don't have a huge amount of robust evidence to prove these associations, but some is emerging. So in terms of school-based physical activity interventions, we have done a lot. So mainly researchers have spent a lot of time, a lot of money has been spent on school-based interventions. So this is from 1980. If we look around 2002, there's been a huge spike, up to about 220, 230 published school-based interventions per year. So this is an awful lot of money, time and effort that's been spent. If we split them up by the adolescent, the teenage years and the child years, we see that a little bit more time and effort has been spent on children, on primary school age children. So with all of these physical activity interventions, all this money, time and effort, have we seen an improvement? So do they work? Well, there's been quite a number of systematic reviews of these interventions, and the conclusions are a little bit dismal. So there seems to be equivocal conclusions around similar studies that have looked at the same literature, and that's partly because of the different study designs, the different type of interventions. However, if we just look at robust study designs and ones that have used objective measurements of physical activity, so we can trust the outcome, we find that in a lot of cases, these physical activity interventions have had no effect, or when they have, they've had trivial effect. And in cases where there have been small changes to physical activity, the interventions have been very expensive. So they haven't actually been able to be sustained. So a question is when they do work, do they actually widen the health inequalities gap? So this is hot off the press. This was just published 2 days ago by a group from Cambridge. And this just shows the number of published interventions. Now these are school-based, community and family interventions that have actually looked to see if an intervention, when targeting a group of lower socioeconomic status or a group of higher deprivation or girls versus boys, whether they've looked to see if an intervention has targeted the most at-risk population. Because most of the time when we look at physical activity interventions, we look at the group as a whole. If an intervention isn't actually targeting the most at-risk population, then it's not a useful public health initiative. So when they actually looked at all of the interventions, most studies, so the grey bars here, show the studies that looked at gender, collected information on gender, body mass index, socioeconomic status, ethnicity, place of residence and religion. So most studies collected information on gender, some on body mass index, a little less on socioeconomic status, a little less on ethnicity, and next to no studies actually collected information on religion, or at least presented that information. Most of the studies actually reported this at baseline. So to be able to show how representative their data, their sample was, they actually presented it. But only a very few numbers actually looked at the results of the intervention by these groups. So to look to see whether X intervention actually was uptaken evenly across different socioeconomic groups, or differently between males and females, or between overweight or normal weight children. If we don't start doing interventions better, where we can actually look to see if they're targeting the most at risk, we're going to limit our knowledge. So it's quite well recognised, even by our government, that schools have to be part of a whole systems approach to increasing physical activity. So this is quite a nice definition by Bill Cole from the United States. Schools may act as a focal point, but alone cannot accomplish the task of increasing and sustaining physical activity in youth, because multiple systems and sectors in society influence the adoption of an active, healthy lifestyle. So that's fair enough. Okay, I think most of us can agree that schools alone can't make our children more active. However, how we get all these systems working together to increase the physical activity is really hard. So I guess at this time point, schools might take a brunt of the responsibility. So having said that, so I think we've agreed that whether they like it or not, schools are part of the responsibility of increasing physical activity. What support are we providing schools? So again, when I was trying to think about this, and thinking back to kind of the 1990s, I imagine, and I can only imagine because I wasn't a teacher now or then, but I can imagine this would be a teacher who maybe wanted to have an active school, who was actually looking for resources, for support, for help to be physically active. In the 2000s to the 2010s, it's got much better, and this is a real celebration. So now if schools want to lead an active school, want to make improvements to their school to enhance the physical activity for their pupils, there's an awful lot of support out there. Okay, so all of the shouting that was done by academics, by researchers, by teachers, by people in the government worked. We all now realise that there is an issue. However, all of this support that we're perhaps providing teachers might potentially, if we're not careful, lead more to this, where they're actually a bit confused. They don't know where to go for the opportunities, the help that they have. So this is just, I'm going to provide a few examples here, and they really are quite positive in a lot of sense, but it's just to highlight the kind of breadth of kind of support that's been provided for schools. So back in 2012, there was an all-party commission on physical activity by our government. And in this, they launched a lot of lofty aims in which they were going to try and meet to help with the inactivity crisis. I'm not sure what's happened with this, but we haven't heard a lot more since the all-party commission was published. There has been some really nice position statements. I always think AFP do a really good one, very, very clear. So there's quite a lot of information out for head teachers, an evidence-based briefing on physical activity every day. There's been some interventions that have been quite long-lasting in schools. So from 1998 to 2010, we've got the Healthy Schools programme. More recently, so I think this was only a few days, another intervention, which was a collaboration between Discovery Education and Nike, which is called Made to Play, which is a school-based programme which is developing a whole school culture around physical activity. You'll all recognise, I think, Change for Life, but the Change for Life has tried to really get into schools to do after-school sports clubs, which the Youth Sport Trust has been involved in. Nike, the Design to Move, was part of developing a very comprehensive, very long guide on how head teachers can make an active school. We have a What Works booklet, which was published by our government and Youth Sport Trust. And then we have, which I love, the This Girls Can campaign, which is really nice, but we have that's coming in now for schools. So we have an awful lot, and this is just a smattering of what's actually available for schools to try and help them be more physically active, which is really great. But I guess a couple of the questions that I have is, how much time do teachers have to actually find this information, to sift through this information? As an academic in this field, I find it quite hard to keep in touch with all the information that's coming out, all the resources, the evidence briefings, the infographics that are coming out for schools. The second thing to question is, are they coordinated? How does a school know what's evidence-based? How do they know how one programme or resource fits with another? So, as I briefly mentioned before, there is a plan now for more support for schools to enhance their physical activity agenda on the back of preventing or decreasing childhood obesity. So this was a plan of action which was released by Department of Health and Public Health England earlier on in this year. And what they've asked the schools to do is accumulate these 30 minutes of physical activity per day. And they gave some good examples: active breaks, physical education, extracurricular clubs, active lessons, sport and physical activity events. So they actually did name running programs in schools, which was great. And they gave a few different kind of support mechanisms by which they were going to help schools across the UK do this. So they said during inspections, Ofsted are going to assess how schools effectively use the physical education and sport premium and measure its impact outcomes for pupils. So on the back of this childhood obesity plan for action, they're going to tax carbonated sugar-sweetened drinks. And through this tax, they say that they're going to up the sport premium. So they are going to help schools by auditing this. Okay, so that's the first support that they're going to do. Public Health England said they were going to develop advice for schools, okay, in this coming year. So that's providing them some more information because they've had quite a lot of information. They're going to make an interactive online tool, which I think is in collaboration with the Youth Sport Trust. So this is going to help schools plan at least 30 minutes of physical activity per day. So a planning tool. So that's great, but that does require a lot of time and effort by members of the staff in the school. National governing bodies are going to offer high quality sport programmes. Okay, so that does seem quite positive as a positive step forward on how Public Health England are going to support schools by meeting this quite lofty target of 30 minutes of physical activity per day. However, we do know that sport doesn't reach all children. Okay? There are some children that really like engaging with sport, and then there are other pupils that we know that don't. They're going to offer a voluntary healthy rating scheme, which will be audited by Ofsted. So this is another audit. And then lastly, Ofsted, which I haven't seen yet, but Ofsted are going to do another systematic review of the literature to provide more information for the schools. So I guess my distillation of this, I guess my question to you is, how useful on the ground might this be for schools who are already overly stretched, have a lot of other agendas that they have to do? How useful will this be to meet this quite lofty goal that they've suggested? So money is always good for schools. I think there's no school out there that says they've got too much money or enough money. Okay, so the money is great. However, with money will come more options. So already we're seeing lots of spin-out companies that are providing or offering to provide lots of ways for schools to be able to spend their money. It's going to be really challenging for schools to know that they are actually having a good programme that's being evidence-based and will be approved when Ofsted do their audit.
But the problem is, schools' finance is being cut. So that's the base level. Yeah. So if you cut the base level funding, and then you've got these little schemes here, which is just going to bring in a bit extra, what is the worth to the school?
Yeah.
And they've lost something, and then they've got to, and I've been in places where you've got to do quite a lengthy report to say why you want that kind of money. And, that, and have the people got the expertise, and probably have, but again, it's a time issue.
Yeah. So
this fund is available, but you have to go through these hoops.
So it's coming back to here. They're getting more money to have an active life, to have more of an active school, but they're having to work really hard for it. They're having to sift through more information and actually do more auditing and paperwork to get this money.
You see that top in italics? That reminds me of when I was at school. Active break times. You see, schools now don't have the afternoon break. Most schools now leave at 3:15. Used to leave at 4 o'clock. So have half an hour break in the afternoon where you have active play. PE, that's another thing that's been, if you don't do a GCSE in sports, then what likelihood you're going to do PE in the last 2 years, year 10, year 11, virtually nil. Extracurricular clubs, again there's pressure on teachers to do that again, but it's more time, more effort, marking papers, etc. So we haven't got that. Active lessons, perhaps not, but other sport and physical activity events, that was part and parcel of schools in the sort of 60s and 70s, and I can remember as a pupil, student, whatever.
So the only innovation here is active lessons. That's a good plug for our grant that we have. No, I absolutely fully agree with you.
I think the major problem is how many schools actually have a PE trained teacher.
Yeah. Which actually is coming up on my slides in a couple, so no, we'll carry on that discussion afterwards. So I think we can give schools money, we can keep making them aware, giving them lots of information, we can give them ratings and we can help them to plan, but is this enough to overcome the barriers that are there for leading an active school? So I just wanted to highlight here a couple of the studies that we've done. This one is just to show you the wall of barriers of teachers when we interviewed them around leading active lessons. Okay, so this was part of an intervention where we were trying to encourage teachers to teach through active rather than sitting methods. And as you can see, they're quite intuitive. I think any of you that are teachers or could imagine a classroom, these are the barriers. It's actually, cost is in there, but it's actually quite a small brick compared to the other ones. All of the other solutions that have been provided are probably not going to overcome these. The interesting thing was that when we looked at the similar barriers of doing a daily running program, a lot of the barriers were quite similar. There were a few that were quite unique. This is cheating of pupils, not teachers here. So we really need to go back and we need to think about what are the fundamental barriers at schools which are very different. So one school's barriers aren't going to be the same as another school's barriers, very much depending on their pupil population, on their geographical location. But what are these barriers and how are we going to lift these? Otherwise we're probably never going to see a change. So, and this really comes back to quite an interesting point that came out of a Cochrane review. So this is a very robust, systematic review of school-based physical activity interventions. And basically the authors were saying we're probably not going to see any changes unless dramatic changes are made within a school day. Okay, so lots of little increments are only going to make incremental changes, small changes. If we're wanting big changes, if we're wanting lofty goals, we need to have lofty, bold changes in our schools. And can schools cope with that? So one point just to think about, because we do have this childhood obesity strategy and we have the physical activity that's been linked to that. And in some ways we have to appreciate that. Because aside from some of the potentially negative sides of the childhood obesity strategy and the pupil premium money that's coming, without this emphasis on childhood obesity, we might get our budgets cut even more in our schools around physical activity. But we also have to be quite careful because if the obesity agenda is mandating our physical activity agenda and it just becomes a case of energy balance, then we probably lose any good quality physical education, physical literacy, and the skills are lost. So if it is just about body mass index, then we are going to lose quality, enjoyable physical activity opportunities for our children. So we do, I think, have to be really careful about just linking physical activity in schools to obesity management or prevention. So I wanted, because it's been a little bit negative up until this point, I wanted to try and think, is there a success story? I don't think there's any silver bullet or any absolute intervention or country that has got it right yet. But to put myself out on a limb, there does seem to be an intervention which is in Finland called Finnish Schools on the Move, which really does seem to be doing quite well. So if you look at actually the activities, the recommendations, the components that they have as part of their intervention, it's not dissimilar to what we've been talking about. So active commuting, physically active breaks, PE lessons, physical activity during other lessons, clubs. But what we do see when you're looking through the literature and their pilot data and the methods paper is that they're quite bold. They're bold with how they're enabling schools to do this. They're large scale, so 80 to 90% of the primary and secondary schools in Finland have signed up and are actively doing this. Although they have this common principles across all of the schools, they are individually tailored, so they are allowing schools to do what's suitable and right for their pupils and their context. There's good government commitment, and I think this probably is one of the essential ingredients. It's lottery funded, so they are also very well funded. They have a really good engagement with the university. So the researchers have been involved from the get-go and are doing their evaluations. So they've got a really good high quality evaluation which is feeding into their programme and improving it as they go. But the most important thing is it's long term. So they're not thinking that they're going to try this for 2 years and then if it doesn't have miraculous benefits, they're then going to ditch it. This is actually a commitment over 10 or 20 years. They've just had the pilot data from this, and the pilot data wasn't amazing. You know, it showed a lot of promise, but they haven't then decided they're going to pull the funding and stop. They're actually evolving it and improving it and carrying on. We need this consistent message. We need things to be brought into one place, but we also need to recognise that we're not going to make changes overnight, that the changes that have happened to our society, which has caused our children to be less active, have happened over 5, 10, 15, 20 years. And it is going to take us a while to actually make those other changes to combat that. So again, not saying we have to hold the space, whether this actually improves, but they seem to be doing really well. So maybe can we look to models like this in the UK and see if we can maybe do as well. So this is where I put myself a bit out on the limb and trying to think about these kind of bold strategies. These are just some things that came off my head. It actually matches up a little bit to what the gentleman at the back was saying. But if we are going to make bold changes, what could they be? Okay, and I'm just going to leave that up there because these are just really my thoughts. They're not all evidence-based. But maybe this will actually be able to fuel into maybe some discussions. But I do think, just one point, one plug to make. One thing that has happened now, say something new that's happened that's actually potentially quite positive, is the skyrocketing of after-school care clubs. So now, as you all know, more parents are working, so mothers and fathers are working, and we now have an increasing number of children that are in before or after-school care clubs. Although we don't have good data to suggest it, my own experiences suggest when I was a child that a lot of the after-school period was spent with children sitting watching TV. Through trying to empower and help these after-school care clubs, we could actually have up to 3 hours every day after school, which could be more active. But these do require a lot of commitment by schools, by governments, to actually release resources, for example. So none of these are easy. A lot of them require a lot of resourcing, and there's lots of health and safety risks with some of these. Okay, for example, allowing school grounds to be used by pupils in the after-school period. I think any head teacher would be horrified at that prospect. Okay, but maybe we need to start thinking like this. So we as researchers can also do better. Okay, so developing effective interventions or not effective interventions, which from my graph I showed you before, is only the first step towards improving the health and well-being of populations. We as researchers need to probably stop doing randomised controlled trials, okay, to try and see over a year whether X intervention, the flavour of the day, works. We actually need to spend more time thinking not what works, but for whom and in what circumstances. So this really does require us to co-produce interventions. We need to co-produce interventions with pupils, with parents, with members of staff. Okay, we need to understand better on the ground what the important research questions are, but what the important ingredients are for an accessible intervention. But having said that, other people such as providers of physical activity opportunities also need to come, and they need to be less concerned about proving that that programme works, but also trying to answer some of the questions that we have. So how can we best intervene? How can we best implement programmes in schools? So this is where we have a plug for Kids Run Free, which is a charity, which is just up at the top here. And they have part-funded a PhD studentship to better look about how physical activity running programmes, their programme Marathon Kids, can be implemented into schools. We need more of these genuine collaborations if we're going to forward this field. We also need to better understand the actual current behaviours of our children. We have a self-reliance on these self-reported measures. We need objective measures of physical activity. In 2008, our national survey collected objective measurement of physical activity, and then for whatever reason it stopped. So since 2008, we do not have a good idea about on a national level, about the physical activity behaviours of our children. If we're going to put in these lofty goals for schools to increase physical activity, we need to be able to surveil it better, and we need to be able to take that out of schools' responsibility. So I think if we carry on like this without some joining up of all of the great opportunities, all of the great moves that we've had to support schools, we're going to end up with this, where we're part plugging these holes, we're not fully plugging the holes. So I guess just to conclude from my, because I've gone very fast and I've gone in lots of different directions, I think we all recognise that schools are not the only way that we're going to solve the problem. We do need a whole systems approach, but a whole systems approach is hard. So I think we all have to recognise that schools might then take the brunt of the responsibility, at least in the shorter term. I think we need bold solutions, not just bold goals. Okay, so this comes back to the childhood obesity strategy. I think we cannot let the obesity agenda fully mandate the physical activity agenda. There does need to be long-lasting commitment to a well-informed school-based strategy that does not widen the inequality gap. So we need to make sure that physical activity interventions are not just improving the already healthy, fit children, but are targeting the at-risk. I think we need to slow down. I said stop, but I changed it to slow down. With controlled trials in schools, they are fine for drugs. Okay, if we want to see if a drug works, then a randomised controlled trial works very well. But they don't work well in schools. We need to understand better and focus our funding and our time on better understanding how to implement interventions in schools. And then lastly, just the final point, is that we do need to start lobbying for UK surveillance systems so we can actually get a good picture of physical activity behaviours. We have one now for body mass index, at least at reception in year 6. Why can't we have one around physical activity behaviours if it's as important as the government is telling us it is? So I'm just going to take this opportunity to show a quick video, and then I'm finishing, about our active classroom intervention.
Our children's lives often involve a lot of sitting, driving to and from school, in the classroom, playing games on mobile devices, or watching TV. As an adult, sitting is linked to heart disease, diabetes, and even a shorter lifespan. However, schools have a great opportunity to change this culture of sitting. But how? Well, by integrating movement breaks into the classroom and teaching curriculum topics through movement. Research shows this may increase engagement, enjoyment, and even academic achievement. So join the movement to promote a physically active and engaging classroom.
So if you want to find out more about that intervention, you can visit classpal.org.uk. So I just wanted to finish off with an acknowledgement, and this is probably not everyone, but the wide number of PhD students, postdoctoral researchers and academic members of staff at Loughborough University that contribute to the physical activity agenda. Thank you.